So if there is changes to the blood-brain barrier, then the toxins, the chemicals we're exposed to every day have more of the ability to get into the brain, which is, of course, where they can do a lot of damage in the brain. And National Institute of Health study found altered brain activity. There was increased glucose metabolism in the area that was closest to cell phone antennas. So they did a study with people. They had the phone antennas turned on and found changes in the way the brain metabolized glucose, sugar. There's studies that have found teenagers. They looked at teenagers and they assessed how long they used the phone to their head and what side of the head. And they did studies with the children, doing different studies that tested their memory. And they found after 1 year of heavy cell phone use, those kids that used the phone up to their head had damaged memory after a year in the ones that were the highest users of the phones up to their heads. There's Yale research that looked at animals and rodents and found decreased memory and hyperactivity in offspring, in the offspring of the mice that were exposed when they were pregnant. And they've done studies on pregnant women and the babies and found behavioral problems that were related to those higher levels of cell phone use in the mothers or in the children as well, and hyperactivity. So you might ask, how did this actually? I've got a mouse. So, how did we get here? What are the limits that protect us? Does the government what are the safety rules that are even in place? Well, many years ago, there was a robust research program. The EPA, the military, the Army, Air Force, there was research going on about wireless radiation for radar, and limits were set. In fact, thresholds, like what was harmful, the idea of how could this harm us, were set way back many, many decades ago. The limits that we have, which were set by the FCC in 1996, are based on small animal studies. They had rats, mice, and small monkeys, and I am talking about a handful of animal studies that were done in the 70s and 80s, where they took these little animals, these little mammals, they put microwave radiation, they exposed them to microwave radiation at very high levels for under an hour, not long-term, not low-level long-term exposures. And they had what they call the colonic temperature. So they were taking the temperature of the animals, and they had trained these mice and rats to press a lever when they wanted food. And when they stopped pressing the lever for food, the engineers and the scientists said, well, that's the level of harm. They've been overheated. They're not getting food, even though they're starving. And that's the level at which there is harm from microwave radiation. And that's how the levels, these thresholds, were set many, many years ago. In 1996, the FCC adopted limits based on those studies and said, these are the limits for wireless 5G and telecommunication systems moving forward. These limits that were set by I'm going to talk about the FCC a lot, the Federal Communications Commission. They have not changed since 1996. They are not designed to address biological effects. They are not designed to protect against cancer, for example, or headaches, or anything that might potentiate, like if you have cancer and you're trying to live a healthy lifestyle so that that cancer doesn't return, or so you go into remission, so you stay healthy. This is not about protecting against cancer. These limits are just about overheating tissue, as were done in those antiquated studies many, many years ago. They are not designed to address long-term exposures. Our FCC limits are based on exposures that were under an hour. they are based on the assumption that if you overheat tissue and you put all of this heat really intensely, that is how harm happens. And they certainly were not designed to address the current way that we use technology, the real world exposure that we have of not just cell phones, but smart devices and laptops and computers and, Wi-Fi printers and cell towers right outside your window. And they also were not designed with consideration of children's vulnerability. Children have more sensitive brains and developing systems. They are more vulnerable. There is a body of research showing the increased penetration of radio frequency into the brain, the absorption into the brain. And also, your brain is still myelinating. We know that children are more vulnerable to wireless radiation. So in 2019, the FCC came out saying, we have decided, after looking at all of the science that's been presented to us, there was in 2013, I should just backtrack for a minute, just to give you the sequence. The FCC asked, what do you think about these limits to the public, to the federal agencies? Should we change them? Are they adequate? Are children protected? And for many years, they had an open record where you could submit comments and science and recommendations. And then in 2019, they said, we don't need to change these limits. They're fine. These limits are adequate to protect children. They're just adequate for the United States. We're going to keep these limits. And in fact, we're going to create new limits for frequencies never even used commercially before, because we need to, 5G and new technology needs to happen and we need to move forward. So our organization, Environmental Health Trust, as well as other organizations and individuals, and I personally sued the FCC for ignoring thousands of documents that had been sent to them. We sent them the science on cancer, on impacts to children, on headaches, on behavioral issues, on damage to memory and reproduction. There were, in fact, over 10,000 pages of scientific evidence, policy recommendations sent to the FCC, to the US government, recommending a change to the limits that we have on what is allowed, what is allowed for the public to be exposed to from cell phones, cell towers, and so forth. In 2021, the US Court of Appeals for the DC Circuit, second highest court in the land, made a decision that the FCC had failed, to adequately review the record that was presented to them. So it was a favorable ruling in our case, Environmental Health Trust et al. Versus the FCC. The wireless radiation limits, that determination to keep those limits, that determination was considered arbitrary and capricious by the court judgment. The court found that the FCC had not provided evidence of properly examining non-cancer harms, such as long-term exposure, children's vulnerability, the testimony of persons injured. There were many testimonies of people writing in with the impact of having a cell tower in front of their home, or injuries that they had, or how Wi-Fi networks had been turned on and they had developed heart issues and various electromagnetic sensitivity and so forth. That was all ignored by the FCC. Also, the FCC had been found to have ignored the impacts to the developing brain and the reproductive system, and they had completely failed to address environmental effects, impacts to wildlife. So the FCC was ordered to address those issues. That was in 2021. We're now in 2023, and they have not responded. There's been no response by the FCC to the court order. The FCC did not appeal to the Supreme Court, so this judgment stands, and we await the FCC acting. We are actually calling on the FCC to reopen their record to allow the new science since 2019 in, to properly develop safety limits, because what happened was when decades ago in the 70s and 80s, actually in the 60s, 70s, 80s, and early 90s, the environmental Protection Agency, the EPA, they were developing limits for wireless radio frequency radiation, and they were abruptly defunded in 1996 when the Telecom Act was passed. So we are asking that this issue go back to our federal agencies with health and safety expertise to develop limits that are protective of people and the environment. So here's a look at our limits that we have. The FCC limits are among the highest in the world for what cell towers and what's allowed to be ambiently in the air. There, we have maximum permissible exposure limits. Many countries have more stringent limits. Now, the limits in other countries like India, China, Russia, Italy, Switzerland, for where people live, like in their homes, are more stringent, not necessarily fully protective though, but they are much lower compared to the US, which has among the most lenient, along with Japan, Australia, and actually many other countries that use limits like FCC limits or ICNIRP limits. You might hear that term if you delve into this. Now, Switzerland, for example, has ICNIRP limits, but when it comes to certain situations, such as inside apartment buildings or schools, they have a more restrictive limit. And there's actually many countries that are similar where they have more protections in place for what they would call vulnerable areas, where children go to school, nursing homes, hospitals, or where you sleep at night. And just to give you a sense of a perspective, so T-Mobile actually commissioned a report to look at all the science and to make some conclusions about the limits and about the adequacy of the limits and what the science says. That is called the Ecolog Institute report. It came out in 2000. It recommended an exposure limit for wireless radiation 1,000 times lower than FCC's current power density limit. That was over 2 decades ago, based on science from 2 decades ago. 1,000 times lower than FCC's limit to protect children in more vulnerable groups and as a precaution. The Los Angeles, California Public School District, they actually state that not only do they ban cell towers on their schools, but they say that they have a precautionary threshold that addresses non-thermal exposures with thresholds 10,000 times lower than FCC standards. They believe it's a more conservative level, that it's important to protect children who represent a potentially vulnerable and sensitive population. And there are 3 Board of Education resolutions. Those have to do with cell towers on or near schools, and they have prohibited cell towers on their schools. Whereas in many communities across the United States and cities, schools are where the cell towers are placed. Now, I should note that the Los Angeles, California Public School District has been criticized for not adequately following this recommendation, and I can get into that later. So I'm going to hop around a little bit because there's just so much to talk about here, but I want to show you an example of imaging. You can't see cell phone radiation, you can't taste it, you can't smell it, but it's very much there and it is absorbed into our tissue. And this is imaging done by engineers showing the radiation going into the tissues of the head. This is computer scientific modeling. And hopefully I'm not going to use this image. And it's actually slowed down in order to, these are graphics that are done that engineers use to see what is the rate of absorption into various tissues, into the brain, into the skull, into the skin, into the different regions of the brain.